everyone, this is Prayuja. So, our project is regarding the procurement for rural clinics. The one aspect that I really like about this project, it is a real-time issue that needs to be resolved. And generally, rural healthcare clinics often struggle with the insufficient procurement or either a high cost of saving or storage, or either could be limited access to the medical supply. So, in my opinion, and based on our analysis, our SaaS based e procurement platform directly addresses these issues. This solution not only reduces the cost but also ensures that healthcare providers can focus more on the patient care rather than just like administrative tasks. Our final recommendation through this project would be that we end up with having a strong problem solving approach to recognize area for improvement and strengthen our financial projections, conducting a competitive analysis. We also ensure that regulatory compliances will be key to securing stakeholder confidence. Also, additionally, expanding the platform's capability through data analytics and exploring undeserved market will further enhance this impact. In conclusion, I would say our project provides a viable, innovative, and scalable solution to a pressing healthcare challenge. By refining certain aspects, we can create transforming product that significantly improves the healthcare procurement for rural clinics. Thank you.
Our second proposal centers around rural healthcare providers, specifically those that operate in a healthcare desert. We are proposing a commercial off-the-shelf or COTS implementation to support their supply chain management. We aim to provide a real-time monitoring, inventory monitoring, control, procurement, and delivery solutions for these rural healthcare providers. This would enable healthcare workers to focus on providing top quality care while we handle their medical supply chain and inventory. We plan to partner with Inflow, a cloud software as a service or SaaS provider, to create a customized user portal, seamless inventory management, point of sale and online procurement platform, as well as warehouse management capabilities. Our key material suppliers would be BD and McKesson. Subscribers to our service would receive regular inventory through lean delivery practices. Automated triggers alert our system that resupply is needed and an order is automatically created. If subscribers need additional supply or different products, unique orders can be placed through the online portal. We deliver as needed from our centralized warehouse. The processes are made possible through Inflow cloud-based inventory technology. Healthcare providers can create their own alerts based on consumption rates. This enables providers to carry less inventory, thereby reducing storage needs. Reduced storage needs can enable them to carry more diverse supplies to handle a broader range of healthcare needs, which is vital in a healthcare desert. Providers would be set up with an Inflow provided scanner, point of sale, and inventory control hardware. These devices will all be tested prior to our deployment. Should a device fail, a replacement will be issued out of our internal supply in a timely manner. Each customer or subscriber location will be treated as a managed node in our warehouse. This would enable monitoring of their inventory remotely and rapid allocation of additional inventory if necessary. These shifts in inventory would be tracked through our warehouse management system and onboard telemetry from delivery vehicles. We would also look to offer 24/7 US-based support for technical issues and priority orders. An online portal would also be available for automated support and online ordering.
Hello, everybody. My name is Angela Pakta, and I will be covering what we applied from this course. So this course definitely informed the way our team approached this project. I mean, the title of the course is Software Engineering Economics. So, as my fellow team members know, and of course, as you know, Professor, since you made the deck, in this course, we covered cost estimation, budgeting, risk mitigation, and resource allocation, and that instruction was absolutely instrumental when it came to preparing our financial analyses, our detailed work breakdown structures, and our risk estimation sheets. It was very helpful to understand the way that software development work should be organized, because we wouldn't have been able to complete the detailed work breakdown structures without it. I also believe that the readings we were assigned supported completion of this project. especially software estimation without guessing. Although we didn't incorporate much of the team topology components into this project, I think it still informed the work breakdown structure because it really forced us to think about the many cross-functional elements of these two proposals, and the way that teams would have to work together in order to get either one of them done successfully. I was not able to attend class in person, but it appears from the various slides that I reviewed over the course of this class um, that the class spent a lot of time talking about different business cases and different scenarios. And I'm sure this is very helpful for my classmates. I always love that kind of thing. There's so much insight to be gained from the experience of others. And so I'm sure it was helpful for the project to think about those proposals in class. And then finally, I think that the homework was informative and supportive of this project because, like so much of the other instruction in this course, it really encouraged an immersive, thorough analysis of the various problems, challenges, goals, and efforts involved in completion of either of the proposals presented. So, yep, that is how we applied what we learned from the course. So, thank you.
Hi, my name is Antonio Maduadiche from Group 1 of the SE 630 Agile Project. Um, my group is talking about transforming healthcare procurement for rural clinics, and I'm specifically answering the question, would you do this in real life? My answer to if I'll do this in real life is absolutely yes. And the reason is that rural communities are often isolated. They're operating with limited staff, manual systems, and supply chain that aren't built for them. This leads to delayed treatments and higher operating costs, both of which hurt clients. So, yes, in real life, solving this problem of procurement is worth it, and it's urgent. I'd like to quickly discuss the core problem. These clinics don't have an efficient procurement option. Many of them rely on spreadsheets and fax for ordering supplies. They pay higher shipping fees and often lack proper inventory tracking. Staff are overburdened, doing everything from care to paperwork. This inefficiency directly impacts patients' outcome. This leads us to proposal 2, the smart solution, using Inflow, a reliable inventory management platform. We pair this with Amazon's warehouse and delivery network to create a smart, scalable distribution model. This lets rural clinics manage supplies in real time and receive shipments faster and focus on what matters, which is patient care. Explaining why I'll do this in real life would not be possible without explaining the impact. It would be able to save us time and money and also create room for possible expansion and also help the staff focus on the real important people, which are the patients. So, yes, I would totally do this in real life because it's practical, scalable, and impactful. Thank you for listening.
Hello, everyone. My name is Emil Barrow, and I'll be giving you our recommendation on the proposals. In our project, we evaluated 2 proposals for transforming healthcare procurement in rural clinics. One option is a SaaS e-procurement platform, which was proposal 1, and the other is an off-the-shelf inventory control system, which was proposal 2. Today, I'll be explaining why proposal 1, the SaaS e-procurement platform, is the better option. Proposal 1 offers significant flexibility and customization. With a custom-built SaaS platform, we can integrate features like real-time inventory tracking and AI-driven restocking recommendations. This approach not only addresses the day-to-day challenges faced by rural clinics, but also keeps our system adaptable for future upgrades. Another strong advantage of the SaaS option is its focus on strategic partnerships. By teaming up with trusted names like Medtronic and BD, our platform gains credibility and secures a reliable supply chain. The scalable 3-tier subscription model also ensures that we can serve clinics of different sizes and budgets. While Proposal 2, the off-the-shelf solution, offers quicker implementation and lower initial costs. It has limitations in customization and scalability. This lack of control could restrict our ability to innovate and meet the unique needs of rural healthcare in the long run. Therefore, Proposal 1 is the clear winner when it comes to longevity and to future-proofing our solution. That being said, after weighing both options, we strongly recommend adopting Proposal 1, the SaaS e-procurement platform. The solution not only meets our immediate operational requirements, but also positions HealthLink solutions for long-term growth and innovation, addressing both current challenges and future opportunities.